So I'm here presenting the essentially end of study results from a project that we started back in 2009 to treat young children who were newly diagnosed with peanut allergy with a form of immunotherapy called oral immunotherapy. So what we showed was that using oral immunotherapy in newly diagnosed children aged 9 to 36 months was both safe and actually highly effective at establishing a state that we call sustained unresponsiveness, which essentially allows them to be able to eat peanut in their diet on a regular basis without symptoms. One limitation of the study is that we did not include a placebo group, and that was because it was a strategic decision at that time when we started the study in 2009. Nobody had ever worked with this age group before in sort of a targeted way, and we felt like it would be inadvisable to try to include a placebo group in that type of pilot study. I'm happy to say that there is now an ongoing multi-center nationwide placebo-controlled study in the same age group. So we will ultimately get the placebo-controlled rigorous answer to the question. So without a placebo control, it's difficult to conclude entirely that the treatment was responsible. It's possible that some of the children in the study could have had a spontaneous resolution of their peanut allergy, but this is only thought to occur in roughly 20% of children that are diagnosed with peanut allergy, whereas in our study, the proportion that were able to incorporate peanut in their diet and considered successes was close to 80%. So what we would consider substantially different than what we would normally expect in clinic. So we use a commercially available peanut flour. And in this study, we took the children and first challenged them with peanut butter, essentially, at the beginning of the study to make sure that they were peanut allergic and to measure the amount of peanut protein it took for them to have an allergic reaction, which at baseline was an average of about 20 milligrams, which is essentially about a tenth of a peanut. So these children were quite sensitive on average at baseline. And then in the study, we randomized them in a blinded fashion to get either 300 milligrams per day of a peanut flour protein, which is, again, about the equivalent of a little more than 1 peanut per day of protein, or 3,000 milligrams of peanut flour. And this was done blinded, meaning that the group that only got 300 milligrams of peanut also had 2,700 milligrams of placebo filler, so that all participants received 3 grams of an investigational product that they took in gradually increasing doses, and they took every day at home. The way this therapy works is this flour is mixed in with a vehicle food, such as applesauce, yogurt, ice cream, pudding, and the children swallow it every day at home. And we did this for a minimum of 12 months of a maintenance treatment once they had reached their target dose, and up to 36 months. And the children could qualify to have their ultimate endpoint measured either on the basis of favorable immune responses to the treatment or the end of the 36-month period. The way we then assessed the response to treatment was at the end of those periods, either when they had met pre-specified immune benchmarks or had met the sort of 36-month calendar qualification, the children underwent a provocation test, essentially what we call a food challenge, where they are exposed to increasing amounts of the peanut protein, intended to see if they are reactive or not. And then if they pass that challenge without any symptoms, they then stop the treatment for 4 weeks' time, and then came back 1 month later and had the challenge repeated off of therapy to see if the protection that they had gained by the treatment persisted. And again, in 29 of the 37, or 78% of the participants, that challenge was successful. They were able to consume all of the material without any symptoms, suggesting that the treatment effect carried over at least a month without any therapy. We call that changed state, sustained unresponsiveness. We still don't know if that means that they are still allergic but in a changed way, or if their allergy has resolved completely. We really don't know yet still how to quite measure that. It's possible that some of these children are still allergic, but in a way that's been modified by the therapy. At the end of the day, what's important is that once they're able to achieve sustained unresponsiveness past that second challenge off of therapy, we then have them essentially incorporate peanut into their diet as if it were a non-allergenic food, and they eat it on a regular basis without having symptoms. So as long as they're able to continue doing so, they remain essentially unresponsive in a sustained fashion, and that's where that term came from. Are they still allergic, or are they fully tolerant? We don't really fully understand that.